For months last year, the sound of clapping and cheering could be heard at precisely 7 o'clock every night throughout New York City and many other cities. It was a ritual that emerged in the pandemic as a sort of thank you to those on the front lines, most notably the doctors and nurses working tirelessly to save lives.
You really did see this shift for the first time in a while that said, wow, healthcare workers, physicians, we need them, right? Like this is really something that we absolutely need.
Dr. Anthony Fauci, the leading U.S. expert on infectious diseases, became a celebrity in 2020, making countless TV appearances. He was even nominated for People magazine's Sexiest Man Alive, and a bobblehead was made in his likeness. Mehta, who founded Med School Coach, an advisory firm for med school hopefuls, says Fauci and others became role models for young people. Demand for Mehta's services grew 100% over the past year.
But we certainly hear from students across the board that sort of COVID and what has happened has driven them towards a career in medicine, nursing, public health.
According to the Association of American Medical Colleges, med school applications are up 18% this year as compared to last year. Applications for grad school programs in public health jumped 40%. 43-year-old Thomas Davila is getting ready to start Columbia University's post-bac pre-med program this fall. He's wanted to be a doctor since a kid, but felt it was out of his reach.
When I started looking around and where I grew up, I didn't see anyone who looked like me or who came from where I came from that were in that position. I saw people who looked like me who came from my family working at the poultry plant.
After high school, he joined the U.S. military. It wasn't until he was in his 40s that he began working as a medical assistant. Last year, he helped administer COVID-19 tests. The experience was a wake-up call to pursue his dream.
COVID showed me this is really what I want to do. I felt like there was a calling that I needed to do this at this exact moment, at this exact time. Everything was laying out for me, and it felt right.
If he gets into medical school, Davila will likely be 53 before he can start practicing. He's pursuing all kinds of scholarships and financial aid, but admits the cost of medical school is daunting. The median cost for a 4-year public medical school was around $250,000 last year. Tuition at a private college will set you back around $330,000. But many schools and institutions are offering help with tuition for medical students who choose to become primary care doctors, particularly in rural areas where there's a shortage. That's exactly what Davila wants to do. Mehta says while physicians make less than they once did, they can still make enough to pay off their debt pretty quickly and live well.
People go into medicine because they really want the service aspect. They want to take care of a person. They want to feel like at the end of the day, they've done something for another person. You'll always have that in medicine, and you'll always be compensated relatively well for that.
Davila is now one step closer to his dream of taking the Hippocratic Oath and practicing medicine. Karina Huber, CGTN.